Ranula is a cystic swelling occurs in the floor of the mandible. It involves mainly in the sublingual salivary gland duct. This arises is accessory salivary gland. The word ranula is described by the resemblance of the swelling to belly of frog. The ranula is occur to the duct and secreted mucosa வரக்கூடியது. Obstruction of the duct வரக்கூடியது. Structure of the duct due to the surgery. Perforation of duct ஏதாச்சும் பிரச்சனை. டைப்ஸ் ஆஃப் ranula, oral ranula, plugging ranula or cervical ranula அப்படின்னு 2 டைப் இருக்குது. இப்போ oral ranula is secondary to mucus intravacation where the mucosal pole superior to mylohyoid muscle which is plugging ranula. Mucus intravasation of the long facial plane of neck. Clinical features. Oral ranula is seen in the young children and adult. The swelling is a type is located in the floor of the mouth to one side of the midline. அதாவது these are seen in the younger childrenல பார்க்க முடியும். The swelling is located in the floor of the mouthல பார்க்க முடியும். அதுக்கப்புறம் the structure of the smooth muscle which is diffused border on the palpation. It is soft, cystic, non-tender fluctuation swelling which is blister transmission. It cover to the mucus is consist of the clear and serous fluid. Hence the bluish color is resemble as a belly of frog. The lesion is causes to the midline of the frog. It is often to the salivary gland. Is difficulty to locate. Large oral ranula is displace the tongue and interfere the functions of the tongue. Interfere the functions of the tongue. If the mass is located deep, it loses the bluish translucent color. Plugging ranula. The ranula is excited to the submandibular region. Submandibular region of the deep part of the posterior margin of the mylohyoid muscle, and it's known as a plugging ranula. The plugging ranula is a intraoral ranula which cervical excision asymptomatic but enlarged cutaneous. A sucker lying skin remains intact or bone. The swelling is fluctuated, freely mobile, is non-tender and by digitally palpable. Investigation. Ultrasound neck or MRI neck should be done. Treatment. Oral ranula mobilization can be done. Is initially mobilization major cyst along to the mucous membrane is the floor. Is exist of the cut edges of the cyst wall. Suture cut mucous membrane. Suture cut mucous membrane. The lateral as a wall of the ranula is thickened. It should be completely excited. If the ranula is small without mobilization, the laser ablation, cryosurgery alone after completion of the mobilization can be done for some patient. Oral ranula. The plugging ranula is required to approaches for the neck to complete excision of sublingual gland. Salivary gland is needed to the plugging ranula. These are the excision is done orally to the excision gland. Complications: there is decreasing in the size. Rupture of the cyst, rupture for the cyst decreases the size is appear to the last date. When the swelling is big, the tongue is pushed upward. It causes difficulty to speech and the swallowing.